So, welcome everybody. My name is Juliet Horwedel with Regional Employee Benefits Council. Today we're going to be doing a webinar on reporting and changes in the Charter Benefits e-system for healthcare reform. A lot of changes are occurring right now with healthcare reform, and our e-system will actually support some of the reporting and the compliance issues that all of our clients are facing. So as healthcare reform changes, so does our e-system. They are doing updates on a quarterly basis to the software. So as we have new updates and new reports that come out, we want to do a quick webinar to share with you any changes that you need to know about. Let's get started. So many of you are aware of the Charter Benefits e-system. This is a screenshot of what the employee dashboard looks like. If there's a new hire enrollment, it'll say new hire enrollment. Employees typically have 30 days to enroll in their benefits from their hire date. They'll click on this Enroll Now button here, and this is their dashboard. Basically, the employer can put anything they want in the library. So if you have an employee handbook or notice or just anything you want to post there for employees, you can post it in the library and employees will have access to that. We can also do featured items. So if you really want to push the EAP, for instance, we have that one here in this example. We can put a featured item here on the dashboard right here. There's been some upgrades to the e-system since some of you have gone through open enrollment last, so your dashboard may have looked a little bit different. But now there's pictures, it makes it more vibrant. Employees like it a little bit better. So what we're going to talk about today is overage dependents. That has been in effect in the law for quite some time now, but I want to show you how it's administered in our e-system. We're going to discuss the W-2 reporting that all the employers are going to have to do for each employee and how our e-system can assist you with that reporting. We're going to talk about the notice to employees of the healthcare exchange availability, minimal essential coverage for full-time employees, the maximum waiting periods that the school can have for new hires, some discriminatory coverage options, and auto-enrollment and reports. So one of the laws that has been in effect is the employers can cover dependents until they're age 26. The Charter Benefits e-system will actually automatically terminate dependents from their benefits when they turn age 26. This is an example of the settings in our e-system. For the plan rules, we put in the maximum age for dependents for non-full-time students and full-time students is now age 26. So when students hit that birth date at the end of the birth month, their coverage will be terminated automatically with the insurance carrier. As many of you know, we sent out some emails that there was a requirement to give the health exchange notice to all of your existing employees by October 1st, 2013. Now, all of your new hires also need to receive that notice within 14 days of being hired. So what we have done is we have built the health exchange notice into each of the new hire enrollments on the Charter Benefits e-system. We can also add any part-time non-benefit employees to the exchange, to the e-system as well, so they can view the health exchange notice. You can also put other documents there for your part-time employees. And actually, there is no penalty for noncompliance, but it is still the law to notify the employees, current and new hires, of the health exchange. So I'm going to show you how we have built it into our e-system. When the employee goes through that new hire enrollment and they click on Enroll Now on their dashboard, and they go through the enrollment process, for most of the groups it says Survey here, and it has the health exchange notice. And it says federal health reform law called the Patient Protection and Affordable Care Act provides for the creation of new state exchanges, which are new insurance marketplaces starting in 2014. So the employees can click here to view the health exchange notice. Once they have viewed it, it'll pop up in a PDF file. If they didn't click on it, maybe they just skipped over it real quick, before their enrollment is complete for all of their benefits, they're going to get this question again at the end that says, have you reviewed the health exchange notice? And they're either going to have to click yes or no. And if they haven't, it's here again for them to click and open. And then you guys, as the employer, will have a record that the employee has actually read the health exchange notice. They've confirmed it here. It's saved in our system, so you guys can pull that up for any compliance reporting later on. The next thing, which is a big advantage of the e-system that will help our employers, our charter schools quite a bit, is the W-2 reporting feature. Last year, this tax year, but for last year's benefits, the employers with more than 250 employees were required to do the W-2 reporting. This following year, fewer than 250 employees were also supposed to do the W-2 reporting. However, the federal government delayed this until 2014. So all of our schools have another year, if you're under 250 employees, to do the W-2 reporting. However, you probably don't want to wait until the very last minute to start doing this process, so it is advisable that you actually start doing the W-2 reporting for this year in January. So basically, our e-system will calculate how much the employee contributed for the year and how much the employer contributed for the year for their health insurance. This is an example. If you go into the billing reports under your reports in the CharterBenefits e-system, there's a billing report called Year-to-Date Benefit Contributions. This report, when ran, will give you the total year-to-date employee contribution by employee, the year-to-date employer contribution, and this employee gross contribution. Down here at the bottom, it also will give you these dates. So if an employee started, maybe they started in March, their first pay period will actually say March instead of the January. But this is based on your first pay period and your last pay period for the full year. So I want you guys to, everyone that has access to the e-system, I would like you guys to go into your e-system and go under reports and check out this billing report. Oops. Let's see. Went backwards a little bit here. So check out the billing report and the year-to-date benefit contribution report, as this report will be very beneficial to you. One of the other things that is delayed now until 2015, but it's good to get ready for it now, is employers must offer minimum essential coverage for employees. That means the plan that you offer must cover 60% of the health insurance cost. I think in our industry with the charter schools, most of the schools offer a fairly rich benefit, so I don't think any of the charter schools are not in compliance with this minimum essential coverage. they say it has to be a affordable cost. So basically, employees can't contribute out of their paycheck more than 9.5% of their annual income. So I think most of our schools are also in compliance with that, but we can help you determine that. We have some worksheets, and actually the e-system will actually help you determine that as well if we have salaries loaded into the system. Penalties. This is going to be the penalties, which again are delayed until 2015 now. For the Patient Protection and Affordable Care Act, $2,000 and $3,000 per year are the employer penalties. This is a chart that we could set up on your dashboard. If we have the income for all of your employees loaded into the system, along with the employee contributions, this chart will show you the medical cost percentage of income for the most affordable plan. This is something we can set up if you'd like. We would need some additional information from you to set this up. Maximum waiting period changes. This is something that is changing. I have a few charter schools that may need to change their waiting periods because they had longer than a 60-day waiting period. But the new waiting period for new hires is going to be a strict 60-day waiting period. Now, what that means is if they were hired on October 15th, they would have to have coverage no later than December 15th. Now, most of the insurance carriers will not start a plan in the middle of the month. So most of our schools are going to be stuck with either first of the month following the date of hire or first of the month following 30 days after the date of hire. So since the insurance carriers will not start in the middle of the month typically. So these are going to be the two options that the schools have to choose. Most of our schools fall into one of those two categories already. Non-discrimination coverage options. This is something I want to make all of the schools aware of because I know there is a few of our groups that may have some grandfathered plans that they're not offering to all of their existing employees. They're only offering them to maybe some employees that were there when the school very first started. They also may be doing different contribution options for some of these employees. So this is a regulation that actually went into effect in 2010, but they have not put any final guidelines to it, so they haven't enforced it, but at some point they will enforce this. So employers need to look at their plans this next year and make sure they're offering coverage to all of their employees equally. No discrimination, no favoring of grandfathered employees or people that have been there for a long time. Health insurance has to be even for all employees. Now, this mandate doesn't apply to self-funded employer groups, so that could be something that is an option for some of our groups, a totally self-funded plan to avoid some of these laws. Now, in 2015, this is something you guys need to be aware of because employers with more than 200 employees are going to have to automatically enroll employees in a health plan if they do not enroll. So a new hire is hired. It's been 60 days. They never enrolled. Well, after about 30 days, if they haven't enrolled, our system can be set up to automatically enroll them in one of the plans. The school can choose which plan is the default plan, and the system will automatically enroll that employee. So if they fail to enroll themselves, our system can automatically enroll. That'll be something we need to look at prior to 2015. However, employers with less than 200 employees are still going to need a payroll authorization if the employees are required to pay a portion of the premium. So the employers could actually either just pick a plan that has no cost to the employee, and that could be the default plan that they automatically enroll people in, or they still have to get that authorization from that employee after the auto-enrollment takes place. Reports. These are some of the common reports in the CharterBenefits e-system. Activity reports, benefit reports, change reports, custom reports. Custom reports is probably the one I use the most because I can select each individual field that I want on the report and in the order I want them. And then pending reports. Maybe you have somebody that selected a voluntary benefit, or maybe they have a newborn, or they just got married. Those pending reports are also very important. So this is just a list of some of the common reports in the e-system. I want to give you an example. When you go into your system, you will click on Admin, and then you will click on Reports. These are all the different types of reports on the side. We clicked on, I think, Benefit Report for this option, Benefit Report. And then you could actually click on Benefit Elections for the employee. This report will give you the plan that each individual employee elected, either during open enrollment or as a new hire. It'll just give you a list of every single employee. Now, these are the different fields you can choose. You can choose different fields in the demographics, address, employment fields, compensation fields, benefit fields. You just select the field you want on your report. If you don't want it on your report, you select this arrow here and take it off. And you can select a field and do up and down, reorganize them in any way. If you want to sort the report by employee last name, put the last name field at the very top. The field that's at the very top is going to be your sort field, the field that it's sorted by. You can also select all benefit plan types. Maybe you just want to select medical or just dental. Also, you can choose if you want just the employee, or maybe you want all the dependents to show up. Then you type in an effective date, and anybody that has an 11/1/2013 effective date or sooner will show up on your report. Then you can save it as Excel, or you can just run it in the web version. So this is an example of how you use the reports. Some helpful tips. You can actually save a report. If you want to see your report every month, you can do a monthly report, and it runs on the first day of every month or whatever day you want it to run. Maybe you want it to coordinate with your medical bill, the date the medical bill is produced. Then you can put in your email address. Once the report is saved in here and scheduled, then you'll receive an email each month when your report has been ran. Now, they don't email you the actual report from the system because of HIPAA regulations. It just reminds you to go in and click on your saved reports here and load it, and you can pull up your most recent saved report. So that's the presentation so far. I'm going to go ahead and unmute it for everybody. All right. Is everybody off mute?
Yes, I can hear you.
Okay. I can hear you.
Can you hear me?
Yes, Karen. Do you guys have any questions on that information?
I do. On the auto enrollment, you said that if you have more than 200 employees, you have to auto enroll someone who failed to enroll themselves. But that doesn't apply to people that have less than 200?
It will apply. It's just you can't take a payroll deduction from that employee without their authorization.
Oh.
So if you were going to do an auto enrollment for them, which you'll still need to do in 2015,
Okay.
you'll have to either have a plan that is free for that employee, or you'll have to get their authorization to take a payroll deduction from them.
Okay, so here's the big question I had was, people can still waive their benefits, though, if they have other coverage, correct?
That's correct.
Okay. All right. That's it.
Now, I'm going to send everybody at the after we're done a copy of this quick ACA reference guide. It has some information in it. These are some of the topics that are in this guide, so everybody has access to it. Does anyone else have any other questions? Did you guys want me to go over any of the reporting, like a live demo?
I have
any
a question.
Information? Sure.
Okay, we never used the system before, so we wanted to know how do we get access to it.
Is that Sylvia?
No, this is Briselda from the middle school, Watts Middle School.
Oh, okay. Yes, we can get anybody that's not set up on the system. I mean, most of the schools are set up for the most part because we actually do all of our internal billing from the system. But if you have not accessed the system, I can schedule a time for us to go over how you access it and how you do all of the basic information, adding new hires, terminating new hires, etc.
Okay. Okay, that's fine. Can I get your phone number?
Yes, you can call us. My direct line is 760-622-6080. My email address is Juliet, Juliet, at CharterBenefits.com. And our goal this year is if any of our smaller groups haven't been using the Charter Benefits e-system, we want to get everybody set up and using it so your W-2 reporting is very easy for you for each additional year you're on the benefits. Does anyone else have any other questions?
Yes, I do. Can you review the W-2 reporting? What exactly do we have to have everyone refill out a new W-2 for the new year? Is that what the W-2 reporting is?
When you guys send out your tax forms to all the employees this year in January, you have to put on there, well, actually it's been delayed for the small groups now. It's been delayed for another year, but they advise you to go ahead and do it this year anyways.
Why?
You'll have to report on there how much the employee contributed to benefits for each employee and how much the employer contributed. So whoever does your accounting, your taxes, they're going to need that information. And that information can be extracted from the Charter Benefits e-system and sent over to your accountant, and they can take it from there to handle the health insurance W-2 reporting.
So how does it work for those employees who do not receive benefits from us because they're not full-time? Or because we don't offer benefits to part-time employees?
Correct.
So do we still have to report that they're not full-time? That they're not?
The requirement is only for full-time employees. So anybody that you offer benefits to, you just have to report it for your full-time employees.
Okay, I got you.
Now, next year, a full-time employee is going to be considered anybody that works over 30 hours. So some of our schools have been only covering employees if they work 35 hours. Now it's going to be lowered to 30 hours. So if you haven't been covering employees, next year you need to start covering people down to 30 hours.
Okay.
Next year that comes in effect, Juliet?
Yes. You were supposed to do the reporting this January for the first time for small groups, but the federal government delayed it for another year. So in January of 2015, when you send out the tax forms, you're going to have to report all of the contributions for 2014.
So Juliet, can you hear me?
Yes, I can.
This is Yvonne. So just a point, to take that point a step further, to have obviously the correct data for the report in 2015, you would want to start making sure that it's inputted in 2014, right? I mean, you'd want to have it tracking. If you wait until mid-year or something like that, then you go to generate the report. Obviously, you're not going to have the correct numbers for that report on 2015. So I think everyone should make sure that your data for your employees as far as their contribution and the employer's contribution is loaded into the system before January 1st. So that's roughly, what, 60 days from now, roughly.
Yeah, and myself and Danielle in our office, we can help get those contributions loaded into the system if they are not already loaded for your group. So many of our larger groups have been already loaded. I know some of the smaller groups are still, may not have all the data in there, but you can give us a call, give me a call directly, send me an email, and we'll make sure you get set up by the end of the year.
Okay.
I have a question too on another issue, Juliet. This notice that was required October 1st for all employees about the exchange being available, it was also required for the part-time employees. Now, I believe, in fact, I know Danielle sent out a follow-up email to everyone to tell them that about their part-time employees.
Correct.
But for new hires going forward, because obviously we're past the October 1st deadline, are not new, I believe, correct me if I'm wrong, I believe part-time employees in the form of new hires that have just been hired or will be hired in the future also have to have that notice.
That's correct.
Now, what is the strategy to make sure part-time people have that notice when typically they don't come into the e-system because they're not enrolling?
Well, we have the option of putting part-time non-benefited employees into the system. The HR team will just have to load the part-time people or send us a spreadsheet for us to load the part-time people into the system as well when they're hired. That's what we can do on our end, so they have that record that they received it. They'd be going through basically a regular new hire enrollment, except for all they would see is maybe the health exchange notice or maybe any voluntary benefits that are offered to part-time employees.
Okay, okay. So I have a question for Patty. Patty?
Putting me on the spot.
I know. But I need your assistance because I'm also working on a workshop today.
Okay.
So like at Puck, would you, what do you think, how do you think you would handle that? What would your option be, knowing your population, but also knowing you have a lot of part-time people? Do you think they're likely to go to the system and do that so that you can be in compliance, or do you think you're going to want to make that part of their new hire package? I'm just curious from your perspective.
We make it part of their new hire package, but then I think it's 50-50. Some of them do go on there. Some of them we actually go out there and help them enroll online, but we always want them to enroll online. So if the majority of our part-timers and who are not English, they can't speak English, we'll help them out with it. So we go out to them, but we always include it in their new hire packet, and we always set them up online so they can do that.
Okay.
It's only going to benefit. It's only going to benefit them, and it's going to benefit us in the long run. And a lot of them are used to it. I mean, you'd be surprised. A lot of them are. They find it really easy, and they find it very helpful.
Here's why I'm asking that question, because I think more schools are going to want to look at their part-time people more closely to help them, assist them in securing health insurance. The health coverage may not be paid by the school. I mean, I know, Patty, you guys have a program that you do subsidize some. I know you have something.
Yes.
But my point is, I think this might be an opportunity for all charter schools to help retain their part-time employees. And a lot of part-time employees are part-time, but they're still very valuable, and you don't want to have a constant turnover of staff in that part-time pool of employees. And so I think two things come to my mind. One is we want to make sure they know about the exchanges because it is a way for them to get insurance. Two, I think that we should start looking at helping them understand the subsidies that they may qualify for through these exchanges. So I know we didn't discuss this in this particular presentation, but that is something we're looking at, how we can help them disseminate and determine if they qualify or if they want to look into the exchange, how to give them some help from the employer. Does that make sense?
Yes.
So it's not in here, it's not in this presentation, obviously. It's something we're thinking about. But the reason I asked you, do you get your part-time people to go into the system? Because if we can get them to go there, then we know where to put the information for them. We know then we can take it to the next level and disseminate that information on the exchange, and also disseminate their subsidies or some information on their getting subsidized coverage.
I think it is half and half. I mean, I think those that are not going online is not their thing. That's why we go out there to them.
Okay.
Or they have a son or a daughter or a spouse who is. And I mean, I just remember one that she's like, I tried to go on there and I don't know what I did, and she tried. So then we sat down together and I had her do it while I was, guiding her through the process. And she said it was really easy.
Well, I just want the HR departments of all the schools to start thinking about that. But number one, it provides a healthier population for you as the employer if your part-time people do have access to insurance. If they qualify for financial support, then you want them to know that. Their job is going to be more satisfying if they know they have insurance and it's affordable to them. So again, it may not be the same plan that the full-time employees are on, but it's still coverage and something they may want to participate or at least have the option to look at.
Yeah, and a lot of these part-time people will probably qualify for subsidies. My dad actually ran a quote for himself, and he works part-time, and he's in his late 50s. And he actually had a rate as cheap as $59 a month for someone his age, almost 60. So that's really good.
Well,
and
also,
the first time he's going to have insurance that cheap.
The other thing too, and this is good for you guys to know as the employer, is in Juliet's case, as she's pointing out about her dad, he also was uninsurable before this because he was a cancer survivor, wasn't he, Juliet?
Yeah.
So he couldn't get insurance.
Wow.
At any price, I don't believe. So to go from not being uninsurable to an insurance plan for what, $59 a month? We want our part-time people, we want our part-time employees to know about that availability.
So Juliet, when we set up this meeting with you, you'd be able to help us to educate our part-time staff on what they're eligible for?
Yes, I've gone through all of the certification courses with the Covered California, so I can actually enroll employees and advise them on their options.
Okay.
So we're going to be putting together some information, and we can set up a meeting if you want at each school for part-time employees to explain to them how Covered California works and how the subsidies work.
Okay, since we have open enrollment in November, which is what, a week and a half away, Because I'm assuming, I think I'm understanding this, we also have to have open enrollment for our part-time employees.
Yes.
You don't have to have open enrollment for your part-time employees because they don't go on your group plan.
Right. Okay.
But if employees want coverage through the health exchange on January 1st, the deadline to enroll is December 15th.
Okay, but we can do it sooner. It doesn't matter.
Well, it may be a good idea to tie it in. It may be a good idea to tie it in. You know, maybe have the part-time people come together, Sylvia, you know, after the full-time people, because obviously the presentation, the enrollment process is going to be totally different.
Yeah, well, because you know how it works here, so that's
right. So maybe after school or something, we could have the part-time people that are interested in hearing about it. Okay. But I'm thinking too, for some of the groups that don't have open enrollment or that just have a large population, we want to be able to deliver this information to them electronically. And so that's why I wanted to know if Patty's been successful in getting part-time people to go to the e-system, then that's where we want to disseminate or store some of that information for them.
Okay. And
see what I mean? Along with full-time.
I have a question about coverage for dependents.
Okay.
It's really expensive, our particular plan, to have your spouse covered. And so the big question from some of our employees has been, is this new Affordable Care Act going to make it possible for me to get affordable coverage for my spouse? And so I don't know the answer to that, and I said, well, I just encourage you to, you know, I gave him the notice and said, look it up at this website and see what you can find out, but I don't really know the answer. And you know what I'm saying? They have coverage through our insurance, but they pay for it fully. We don't pay for our dependents. We only pay for the employee. So can they find...
The employer is not required to cover the dependents. It's only the employee that the employer is required to cover. Now, if those dependents don't work somewhere else, children obviously, then, you know, the exchange could be an option because people qualify for subsidies. I think it's up to like 80 grand a year you can make, and you still qualify for a subsidy.
Wow.
So it's pretty substantial.
Okay.
I think, Karen, I think that, yeah, it is going to depend on the household income. But as Juliet said, the tiers or the minimums for those household incomes are pretty high.
Okay, so chances are very good they can find cheaper coverage on the exchange for their...
I would say there's a strong chance. They certainly should not ignore looking at it.
Right, and I've told them, you know, you just need to go look.
Yeah. Again, we're going to, you know, we don't want to take away time from our full-time responsibility of taking care of full-time employees at the schools, but we do want to make an attempt to assist these part-time people. Don't think it's quite as easy as it sounds on the 10 o'clock news. You know, that you just sign up and
Yeah,
I'm not saying the website isn't simple, but, you know, of course, everyone knows about all the glitches that have been run into. That'll be sorted out. That'll be sorted out in time. But in the meantime, I think the anxiety and the questions that employees have, like the ones that are coming to you, Karen, I think we could help employees with that, part-time employees and their dependents with that.
Mm-hmm.
So, Julia, I think maybe you could just draft something up and send it out to certainly every attendee on this workshop and make sure they have...
Yeah, I'll send it out to all of our existing clients.
And make sure they have your contact information to help some people through that.
Okay, well, do we have any other questions before we end today?
Let's say one of our our employees whose spouse is currently covered, but she wants to look for cheaper insurance for her husband. Does the December 15th deadline apply to someone who already has coverage? I don't know. I just don't know much about this. Does it apply to everybody? Everyone has? I don't know. I don't know how it works. Sorry.
Well, this year they're going to be extending enrollment through March, I believe it's March. So if you want a January 1st effective date, you have to enroll by December 15th in the health exchange. If you want a February 1st effective date, you have to enroll by January 15th, and so on.
Okay.
So they're giving 6-month window this first year to enroll in the exchange. Going forward, it's going to be more like how Medicare is structured, where they're only going to give you between October and December to enroll for a January 1st effective date, and that's it. They don't want somebody, oh, I need surgery now, let me go get on the exchange real quick. They don't want that happening. So they're going to be limiting the enrollment period going forward between October and December, but for this first year, they're giving us 6 months to enroll from October through March. If a spouse decides in January, this exchange is cheaper for me if I go on the exchange, then they can enroll in the exchange, and you can terminate dependents at any time from your group plan. You just can't add them on at any time. So if they got coverage elsewhere, the employee could show the proof that my spouse bought coverage on the exchange, please remove them from my coverage at work.
Okay.
Just a caveat on that, Karen, and to everyone. If someone does do that, make sure that they show you evidence of coverage on the exchange before you terminate them from the group plan. You want to see written documentation so that the employer doesn't become liable if for some reason their coverage doesn't go through. You know, they're going to now verify income, so it's not just going to be a verbal or a form that they complete. They're going to have to show evidence. That was decided last week, that they're going to have to show evidence of income. So you just want to make sure to cover your employer responsibility that you see written documentation that they have been accepted on the exchange, what the effective date is, then you can go terminate them off the group plan.
Okay.
All right, do we have any other questions?
No.
Well, I'm going to send everybody out this guide that has some more information on healthcare reform. We will also have the recording of this webinar up and available. We'll send out the link when it's available to all the attendees today and anyone who wasn't able to attend today. And we're going to be following up with some more information on the exchange for your part-time employees to help guide them and answer some questions.
And if I could make a quick last-minute request, if you guys would take a moment and just send us a quick email, you can send it directly to me or to our office, contact@CharterBenefits, either email. I would just like to know how helpful this workshop was for you, if there's anything we could or should do differently, and if there's any other topics like this you'd like to have. I mean, this is a pretty convenient format, I think, to be able to, you know, take 45 minutes out of your day and get some information that can help you with your day-to-day job. But tell us if there's other things that we can do and any improvements you'd like to see. Please, let us know that.
Okay.
Sounds good.
All right, I want to thank everybody for attending, and please give me a call or send me an email if you have any specific questions about your specific group.
Okay, thank you.
Thanks, Juliet.
Thanks.